Good morning. Welcome back to PSA Q&A, where we answer the most frequently asked questions by psoriatic arthritis patients and those who are wondering whether they have psoriatic arthritis. Our topic today is, how much will a biologic affect my immune system? So this is a question that comes up a lot, particularly from patients who have been recently diagnosed. They're finding out they're going to have to go on a biologic, they're going to have to get updated vaccinations. They're hearing it's going to affect their immune system, and usually they're really scared. I will tell you my experience. Again, I'm not a doctor. I'm only coming at this from a patient angle. So I started my first biologic about 2.5 years ago. I have done anti-TNF inhibitors, and I have also done an IL-17 inhibitor. So both infusions and injections. I've had experience with 3 different biologics over the years, and though I haven't experienced them all, it sounds like the experience is basically the same. Now, what's the reason it's affecting your immune system? When you have psoriatic arthritis or another autoimmune disease, what it means is your immune system is overactive. It's attacking its own tissues, or it's causing inflammation in the body that in turn is attacking tissues, joints, organs. The only way to really get that inflammation to calm down is to reduce the effectiveness of your immune system. It sounds really scary, but the fact of the matter is it's overactive. So a normal person's immune system is here, yours is here. So the idea is to bring it down close to here. It's not gonna drop you down like chemotherapy. When there are viruses going around, like a cold, the flu virus, a gastro virus of some kind, I usually do not get it. Even on biologics, I usually do not get it. And I have 2 high school age kids who live at home. For example, last winter they got whooping cough, which I don't even know. We were vaccinated. Everyone was vaccinated as a child. But whooping cough has been really virulent and strong where I am in Arizona. And so last winter, my kids, actually I have 4 children, 2 of whom are college age. They were all home for the Christmas break, and they all got it. It lasted weeks and weeks. I was heavily involved in taking care of them while they were ill. I never got it. So, do you need to be worried about catching everything that goes around? Probably not. Obviously, everybody's body is different, but my experience, and generally that of other patients in the psoriatic arthritis community, is you're actually maybe less likely to pick up those viruses. If you do pick up a virus, though, you will need to watch and make sure it doesn't settle into your chest and cause an infection. We do see that sometimes, and I'll circle back to that. Maybe you don't need to worry about a cold or a flu or things like that, but there are more particularly virulent infectious diseases that you do want to make sure you're protected against. If I were to go back and start on a biologic for the first time today, I would probably have my measles titers run and see whether I need a measles booster. Measles is going around close to where I live. I'm a little bit nervous because when you're on a biologic, you cannot take live vaccines, period. No live vaccines. And measles is a live vaccine. I would get that done. The shingles vaccine, I had chickenpox as a kid. That means that I'm prone to get shingles. My husband has had shingles. You are probably likely to be vulnerable to shingles if you are exposed. So normally the shingles shot is only available to people over, depending on where you are, 50 or 55. But if you go in and explain that you are immunocompromised or going to be, and why, most pharmacists will be just fine to go ahead and give you the vaccine. If they're not, you can definitely get a prescription from your doctor. The pneumococcal vaccine, kind of the same deal. It's usually not given until patients are older. But if you are going to be immunocompromised, they will give you the vaccine. So I had the shingles vaccine and the pneumococcal vaccine before I started my biologic. At that time, those were the only things we were concerned about. Now I would do measles, but talk to your doctor. Don't take the word of some woman on the internet. Definitely talk to your doctor about what vaccines you should have. When I'm on a biologic, I really don't take any further precautions than normal as far as trying to avoid disease. I actually don't go around with a mask on. I know some people who do. I applaud them. I get migraines and it's just not happening. I can't have stuff here. COVID was rough for me. So I don't do that, but I do wash my hands, like maybe twice as frequently as often if I know things are going around. Maybe it's the first month of school, my kids are gonna come home with some things. If anyone in my household is sick, I don't isolate myself, but I do make sure that I'm washing my hands more often, that I'm cleaning surfaces more often, things like that. If you come down with a virus, particularly something that affects like the sinus system, watch carefully, because those can settle into the chest and then not want to leave and turn into walking pneumonia. If you think you've got any sign of pneumonia, like you've been done being sick for about a week, but you've got a cough that's lingering, you're having a little bit of a hard time breathing, get seen. Doctors, even like urgent care doctors, will, if you explain that you're immunocompromised and these are the symptoms you have, they'll listen to your lungs, they'll decide whether they think you're at risk for pneumonia, and they can get you an antibiotic right away. If you wait, you're going to be fighting it longer. So the sooner you get in when you think something just is not right, the better off you're going to be. Some people get increased UTIs. Some people have thrush infections in the mouth. I have not had that. I'm really grateful for that. It looks and sounds really unpleasant. But I know some people have had repeated thrush infections when they start a biologic. So talk to your doctor about that. See if there are specific guidelines or medications that they can give to maybe help prevent those things, or definitely to treat those things. But as far as how it's affecting my everyday life, am I walking around nervous that I'm going to pick everything up? No. Have I ever been in the hospital because of an infection from my immune system being reduced? No. It's really not been a very big deal for me being on a biologic, and it seems like, based on input from other patients, that's generally the case. Life goes on pretty much as normal, except reduced or no pain. So a biologic is a huge win, in my opinion. The benefits of reduced psoriasis, reduced inflammation, reduced pain, reduced fatigue far outweigh the possibility that I might get an infection if I get a cold. If all I have to do is take a week or 10 days of antibiotics once a year or even twice a year, but I get to live my life pretty normally otherwise, that's a win for me every time. Don't be afraid to go on a biologic. There are patients out there who have been prescribed a biologic and let it sit in their refrigerator for months because they're afraid to take it. I can only tell you there are patients who would give their right arm to be able to be prescribed a biologic because they're not feeling very heard by their doctor. If you have a doctor who's willing to prescribe you a biologic, you need it. They do not prescribe them lightly. So please, please take it. Please try and stop this disease in its tracks, because it is degenerative. And you can end up with lifelong bone damage if you put off treatment.